and then we'll go to section 2 of test taking. Okay, so how to study and references. How to study. Try to associate what you learn with past experiences to anchor them, like patient encounters, to enhance retrieval of facts, like hyperparathyroidism. I had Mrs. Jones who had hyperparathyroidism. Her calcium was high. We used drugs to minimize that. We didn't give her vitamin D. So just remember things related to a patient you've had, because most of you have had years and years of patient experience. Focus when you study, you're more likely to remember facts, and when we start to fry your brain, go for a walk or do something else. When I studied for the headache boards, I had my own apartment, and I took a month off, and I would study 4 or 6 hours, go for a walk, study 4 hours, sleep, study 4 hours, eat, study 4 hours, sleep, study 4 hours. And so I would just study off and on in intervals until my brain started to not work, and then I'd do something else. Study high-yield information, not just anything you can find, so like this board review course, books, other things that are focused on the exam. High-yield information, the ACLS manual is good for cardiology stuff because 10% of the exam is cardiovascular. The modules have very good, the lectures here have very good information for cardiovascular stuff. I reviewed them and they seem to be very updated and good. I would look at the ACLS rhythm questions on their website. So on the website for ACLS recertification, they have some rhythm questions. I don't remember if you have to take the course to be registered. I think you could just see them, at least used to be able to. ATLS, less so. PALS or neonatal, maybe if you're doing the peds section. I'll think a lot about cholinergic and anticholinergic pharmacology. There's lots of questions on those. There's lots of questions on pharmacology in general. We talked about that. If you're going to take the geriatrics section or you didn't score well on that, then look at a geriatrics book or a manual separate, because the questions there, they try to make things that are right in geriatrics and wrong in general medicine. Then the SAMs, the ABFM things, any of the SAMs that you've taken for your recertification, you can go back and print those out. So you can go back and look at the answers and the questions and answers from that, and that's a good thing to study for cardiovascular stuff in particular and for pulmonary. So CAD, CHF, hypertension, I think there's an asthma and a COPD one. So those two things are both 10% of the exam, so I would think about using those. Learn the drugs, learn the side effects, learn the procedures and their complications. This is a society where there's a pill for every ill and a pharmacologic answer to every question, and some of those questions will come back and bite you on the board exam. How to study. Review the topics several times. Research shows that the majority of people forget more than 80% of what they learned within 1 to 2 days unless it's reinforced and repeated within a reasonable time frame. Don't study more than 3 or 4 hours at a stretch. Split it up even better into 1-hour intervals to optimize attention. Exercise some if you're able to, but not too intense. Some people like study groups. A lot of people find them distracting. So what do we do to reinforce things so that we learned it, and how are we going to keep it in our brain? So before we get to that, I'm going to tell you that I think you should try to get 7 hours of sleep a night when you're studying. I think you should not use alcohol. I think you should, unless you have some reason you have to be on them chronically, you shouldn't take benzodiazepines and narcotics, because all of those things impair memory incorporation. And then no fun? Okay, you're going to have some fun, but not too much fun. How to study. You need more studying if you scored below the 50th percentile on in-training exams or in general. If you always sort of struggled with test taking, don't focus on recent journal articles and findings. In the last 6 months usually is too recent to be on the board in terms of working their way through the process and them thinking it should be worked into clinical practice. The board doesn't test controversial issues or new breakthroughs until they're more proven. Who are you and where you are? So what is your practice like compared to the breadth of the exam? So if you're practicing just sports medicine, you're going to need to study a bunch of these other things. If your practice is general family medicine, especially if you're in an academic institution where you're getting charts from the specialists all the time, then less trouble. Ask yourself the question, why didn't you become a pediatrician? So you could take their open book board research exam. Is your practice specialized? Are you missing some developments? Are you part of an academic institution? So these things actually help you remember. It may seem stupid, and if you live with your family, they may think you're wacko, but saying things out loud increases your ability to remember them. And then writing them down, that's what I did in college. Every time I had a list of 50 key things or 100 key things I needed for an exam, I'd write them over and over again. So that activates different pathways in your brain and makes them remember them rather than just looking at them. So you could even make them into a song, and then when you're in the psychiatry ward, I'll come visit you. Okay. So quartiles, checks and balances, the exam is scored by quartile. If the top quartile misses the question, then it gets looked at and often tossed. Trust your own database. If you haven't been in practice for a while, think of what you saw in the wards, what your whole group does, what you see when you cross-cover for your partners. Unless you're on the wards at a tertiary hospital that just specializes in something, you'll mostly be seeing general medicine. Which is more common, multiple sclerosis or amyotrophic lateral sclerosis? Well, if you're in a group of 5 family medicine docs, you probably know that you got 3 or 4 MS patients and maybe you had 1 person who died of ALS. And so you can just use that database from your own practice plus your common stuff. Or how many people during your residency did you cross-cover for that had MS versus ALS? So you have that data, you just don't know you have it. But if you trust your instincts and think about what you've seen in your groups and think about what you've seen in your practice, a lot of that information is accessible to you. Then mapping the territory of the exam, so the subject of the questions, the answers to the questions, and the distractors. Those together represent a good map of the sum of representation of what you want to know about a subject for this year and for next year and for the year after it. So for each of the identified topics, how do you diagnose it? Lab imaging, special testing. How do you treat it? Pharmacotherapy, first, second, maybe third line treatments and procedures. The risks and side effects of each treatment. The natural course of the illness. What happens if it's not treated? How long do people live with this cancer? What kind of side effects do people with lupus get? Epidemiology. Who gets it? Age, gender, ethnicity, specific kinds of risk factors. Pattern recognition. There are separate things that you just recognize as classic appearance or a pattern to something. So like a green stick fracture, a fat pad sign, which is bleeding into the joint, usually at the elbow, a hot bone scan that lights up, hypochloremic metabolic alkalosis when you have persistent vomiting from pyloric stenosis or another reason. Apparently marijuana is another thing that causes persistent vomiting. I think I had one patient who had that, the GI docs figured out. Aunt Minnie's. So what's an Aunt Minnie? It's like, how do you know something? How do you know your Aunt Minnie? Because she looks like Aunt Minnie. So purpura. Purpura looks like purpura. Lyme disease. Centrally clearing rash with a sort of raised, almost vasculitic-looking border. Iritis is perilimbic conjunctival injection. Calcific tendinitis, little spot of calcium, usually at the shoulder. Bowel obstruction on a plain film. 6 loop, 6 or more air fluid levels. Aortic and nasal drainage with a skull fracture. Think epidural hematoma from middle meningeal artery. Paget's disease of the skull, sort of punched out lesions all over the skull that also could be metastatic disease. Free associate. So when you're trying to learn and study, you think aortic and nasal discharge of the skull. Oh, that's we see that with a skull fracture and the temporal bone. What other kinds of diseases do you get in the temporal bone? You might see something like Paget's disease, which maybe 6% of people could have. Ask yourself, is this the right scope for a practicing family physician in the specialty in general or in the module exam? So an interested practitioner active within the field of OB is going to know a lot more OB than people who haven't done it for 20 years. And so you might get a couple of those questions on the general exam, but if you think, I think I'll just take the OB exam because I kind of like that, it's like, maybe not. Be systematic. Think about diagnosis, lab, imaging, special testing when you study. Think about treatment, first, second, and third line. Emphasize pharmacology. What to study? Study the drugs used to treat the condition, study the side effects, study the complications of the procedures used to treat the condition. References. So take an API course on the subject. If you're going to take the PEDS module, you could take the PEDS course if you wanted to. You could buy a PEDS reference book. I like the 5-minute clinical consult. They update it every year and they have an online component. Rakels and Taylor's Family Medicine are usually pretty up to date, and something else that's pretty up to date is up to date. However, it is very deep and has a lot of sort of technical data and studies and stuff. Wikipedia is surprisingly accurate, and I've actually been editing things, headache things and stuff on Wikipedia, and so they're fairly good, but they tend to favor meta-analysis, and so most of the stuff in Wikipedia has to have meta-analysis level data to be accurate, and so that's why a lot of the conditions you get accurate information there. So this is the 5-minute clinical consult, comes with an online version, probably costs a couple $100, but it's a nice office reference to have, and it has everything you need to know about a condition on 1 or 2 pages. So go to Amazon or a similar site to find materials, look for the things that are published in the last 1 to 2 years, and look for things that are 4 or 5 stars on the review. Because by the time things have 20, 30, 50, 400 reviews, if they have 4 or 5 stars, they're pretty good. Using that model, the ones that I would pick, the last time I went through, obstetrics and gynecology board review. I used this when I studied for the board exam. I just did the GYN part, and I smoked it because there was all the stuff I needed in there. Pediatrics, a couple of good reviews, seem fairly recent, but look and make sure they're up to date. Sports medicine, there's a separate study guide for the review book. Geriatrics, I couldn't find a good general one. There are like 7-part, $2,000 things for the CAQ, but it's like, I don't think so. But a geriatric nurse practitioner certification would actually have the kinds of thinking that you need for a family medicine geriatric board question. There's separate emergency room boards. Those are more depth than you need, but you need, the urgent module is not just urgent care, like, oh, I have otitis media, what do I do? It's more ER stuff. It's DVT, it's presentation, it's acute onset stroke, it's acute MI, it's dog bites. It's a bunch of acute, more intensive stuff than just urgent care stuff. Hospital medicine, I couldn't find a specific one for that. I might look for an overview book like Hospital Principles and Practice, but unless one's been written recently, I didn't find that. So reviewing versus learning de novo. When I took part 1 of NBME, I didn't know very much anatomy because my school was molecular science based, so we didn't have anatomy till the second year. It was taught by surgeons, and it was only 6 weeks long. And so I thought, well, when I get to the boards, I'm going to study really hard for that, so I'm going to set aside 3 months. And then I thought, well, I'll set aside the last month. And then I thought, well, I'll set aside the last week. And then I thought, well, I've been studying pharmacology and physiology a lot. I'm going to do this the last 3 days. So then I started studying, and I went, I don't know this stuff. I'm like having to learn this from scratch. I'm just getting panicked. It's like I'm not reviewing anything. I'm trying to learn it. So then I went out and played tennis in a stage 2 smog alert and slept sitting up all night. And then I went and took the board exam. And fortunately, every third year, a lot of it's neuroanatomy, which I knew. And so I was able to pass that part. But you have to decide if you need to learn something, spend the time up front. Don't try to learn it when you should be reviewing it. Concentrate on learning early and reviewing late. Practice taking long tests. That's like pumping iron for System 2. So I made my kid do that when he took the LSAT, and he went from a good score to a score that got him into a very good school because he practiced taking long tests. So System 2, you need to be able to keep System 2, that analytic, alert, non-intuitive, non-reflexive part of your brain. You need to be able to keep it on for a prolonged period of time. So take long exams. Don't just take a few questions, go out and have a beverage. It's like keep at it so that you're hammering. I like this resource, Brain Power. It's by a guy I know named Michael Gelb, and it talks about improving your mind as you age. And so there's a combination of things from mind-body work to nutrition to exercise and things that help brain. Other things that help for relaxation, paced breathing apps help you. So it's the exhalation that turns on your parasympathetic system. So a slow inhale, a long exhale. When the respiratory rate of about 6 will get you out of sympathetic and into parasympathetic things. There are breathing apps for both Android and iPhone. Usually we breathe 14 to 18 times a minute, but if you get your breathing rate down to around 6 a minute, especially if you can learn to do it without hyperventilating, even though you're breathing slower, if you breathe too much deeper, you will shift your ionized calcium and get all tingly. So heart rate variability, get your respiratory rate under 10. Most people have a peak frequency at 4.5 to 6. If you assume it's 6, you do an in-breath of about 3 seconds, a slight pause, an out-breath of 4.5 seconds, and then a little bit longer pause. That will turn off your sympathetic nervous system and turn on your parasympathetic nervous system. There's a device I like, an audiovisual entrainment device called the David Delight. It will help you to study and learn and read more. It's like electronic caffeine without the side effects. It also has a mode that will slow your brain down and help you sleep. Neurofeedback is probably the strongest thing to do. It will improve your IQ. It'll improve your peak alpha frequency, which is related to how much your brain is degenerating and how it's functioning. So practice, learn not to hyperventilate, breathe abdominally, and be into the stillness in the transitions, because that's what gives you the peacefulness. So what should I do? It depends. So you can do, when you're studying, you can take a broad overview with some examples. You can do an overview and discuss the details where you make the notes. You can do an overview and write the details, and that's what we've done here, is that you have all the details written down in your notebook so you don't have to take the notes and read later. Or you can have the details spelled out and reviewed, and that's hammer time. So I would suggest that you use these books as well as the online resources to really dedicate that. And then if you're somebody who needs to get all this in your brain, don't wait till the last minute. Dedicate a certain number of hours a week to study for this stuff. So my system, module focus, practice what you can study 13% of the time based on distribution in your prior performance of your practice. Study intensity. 10% of the exam is ortho room, and that is completely hammerable. I'm having people make flashcards of the ortho and room modules in my notes. I've had people improve their score on that 200 or 300 points. Women's health is narrow but deep. You could learn that de novo, but it takes a fair amount of work. Cardiovascular and pulmonary each are 10 or 11% of the exam, and so go for them. Flashcards. This is the system that I use to not just have something pass through my brain, but to get hardwired. So there are electronic versions of flashcards. I'm an old paper flashcard guy. So you go through the full stack, you see which ones you know and which ones you don't know. The ones you don't know, you repeat until you know them. And then you take both stacks and you review them on day 1. If the things you consistently don't know, you review them on day 3, on day 7, on day 14, and you learn that on a cumulative basis. So I did that when I was in organic chemistry in college, and I ended up actually knowing this stuff rather than having to learn it for the subsequent tests, which was good for synthesis exams because then I had a whole bunch of compounds in my brain rather than just what I memorized the night before. But if you're studying stuff for the boards, reinforce it at day 1, reinforce it at day 3, day 7, day 14, day 28. So that keeps those circuits actually wired, the whole what fires together wires together, rather than have it just be something that passes through your brain that you might have a passing familiarity with. Good luck on the exam. I wish you all the very best, and I'll stick around for anybody who wants to talk about stuff.